Good morning. Yesterday we announced one new case that was connected to a child care facility in Charlottetown, and today we will provide an update on that situation. But before I turn it over to Dr. Morrison, I just wanted to take a moment to remind Islanders that our success to date is based on the collective effort of all of us. As Dr. Morrison has said in the previous weeks, we are one bad decision away from an outbreak. And given all that we've been through, how close we are to moving beyond the most difficult stages of this, we need every single Islander to continue to follow the protocols. We all know them. We've lived with them for almost a year and a half. We can recite them by heart. And because we have followed them, we've enjoyed the most normal daily lives, so much more so than anyone in this country. But when we don't follow the protocols, it's not only maddening and frustrating, but it has impacts that go far beyond that one individual or one household. It puts others at risk. It impacts their lives. It causes unneeded stress and worry and concern. And those concerns are not just COVID health. There's social alienation that impacts mental health. It disrupts society, and not to mention the financial impacts of individuals, families, and businesses. So let me remind every single Prince Edward Islander that any non-compliance of public health measures will be referred to enforcement and charges will be laid. There's no discretion on this. If you don't follow the rules, there will be repercussions. So far, every single charge that has been contested has been upheld in court. And we are continually looking at strengthening the enforcement measures and penalties for those in the minority who are not in compliance. We've gotten to where we are today not by being selfish, but thinking only of others, by staying united, by following the advice of Dr. Morrison, and most of all, being, like every Prince Edward Islander, looking out for each other. And we need this to continue. We need it more so than ever. The finish line is within sight. Let's continue to run toward it. So with that, Dr. Morrison, I'll pass it on to you.
Thank you, Premier. So we have 2 new cases of COVID-19 to report today. Both individuals are in their 20s. One is a close contact of the case announced yesterday, and the other is unrelated. Both of these new cases have a history of recent travel outside of Atlantic Canada. These cases bring our total number of cases to 190 since the pandemic began, and currently there are 9 active cases in the province. So as a recap, yesterday morning we became aware of a case of COVID-19 in a worker at the Leaps and Bounds child care facility. Parents of the 38 children were contacted and asked to get children tested, as well as the other 7 staff who were also tested. In addition, 7 other close contacts were identified and asked to be tested. All close contacts were advised to immediately begin self-isolating for 14 days. As of this morning, 35 children have been tested and all are negative on their first test. 7 staff have been tested and are all negative. The 7 household contacts have been tested and 5 are negative, 1 is positive, and 1 is yet to be tested. All of the children attending this child care facility and the staff are considered close contacts and will be required to self-isolate for 14 days. All other close contacts are also required to self-isolate for 14 days. And all close contacts will be tested again on days 4 to 6 and day 9 to 11. And just as a reminder, and I had a chance to speak about this last night as well, in the process of an outbreak, early identification, of course, so important, and the isolation is important. And I think it's worthwhile clarifying that even if someone is negative today, it means that you still need to continue to isolate, but it means that you would not have been able to infect someone you saw yesterday in terms of your coworkers or families. But it's important you stay in isolation because maybe in 2 days you will become positive, but if you're in isolation, you will not have then had that chance to transmit the virus to others. Yesterday, the lab did process 1,086 tests, including 131 under the age of 19. We acted quickly yesterday morning. Of course, all the close contacts asked to be tested and isolate for the 14 days. And certainly it's encouraging at this stage to know that all but one of the close contacts have tested negative at this point. And further testing will identify if there's been any further transmission. We were able to confirm that the source of the case is travel related. And at this point, there's no evidence of widespread community transmission. I do recognize, and I know the Premier talked about it, that this situation is stressful, inconvenient, and disruptive for families. We feel badly for the families that have been impacted and have to isolate. Thank you for your cooperation and support, and it is just so important that we isolate so we can contain the spread, and we will get through this together. And as we always say in the regular briefings, let us continue to be patient and kind. Thank you. I'll turn it over.
Thank you very much, Dr. Morrison, and we will now turn it over to some questions from our friends in the media.
Wayne Thibodeau, CBC.
Good morning, Premier King, and good morning, Dr. Morrison. Can you help us understand the source and the connection? So did the daycare worker travel? Did someone in their household travel? And then you did mention that one close contact tested positive. Can you give us a better indication of the source of this case at the daycare center?
Good morning, Wayne. So there was a close contact of the person at the individual at the daycare who did travel, and they have tested positive. And so that is the travel-related source and a close contact of the person at the daycare.
And so did this person not follow the rules? Are they facing charges?
Yes, it is being referred to enforcement.
Thank you very much.
You're welcome.
Dave Stewart, The Guardian.
Good morning, yes, good morning to you both. Wondering, did this person in question go to work asymptomatic, or did they go to work knowing they were sick?
And hi, Dave. And you're referring to the case from yesterday at the daycare? So there's certainly indication that they were at work symptomatic, and that is why we emphasized that yesterday as a reminder to everyone, but that is also our concern.
So it speaks to, I think your message yesterday was, you said how important it is that people, if they're not feeling well, should not go to work. I'm assuming that that relates to this case.
That is that does relate to this case, and at this stage in the pandemic, as I said yesterday, there are screening protocols in place at work sites that that people should not be going to work when they are sick. And after a COVID test, they are to isolate until the results come back.
Great, thank you very much.
You're welcome.
Louise Martin, CBC.
Hello, and Thanks for taking our call and for holding this briefing today. So I obviously get the sense that you're both frustrated and a little annoyed by people not following the protocols. So I'm wondering, we've asked this before, but now, given the seriousness and the implications for so many people and the disruption to so many people, is there any sense of looking at increasing fines or punishment for people who don't follow protocols?
Yeah, I'll probably take the first part of that, Louise. I think Dr. Morrison and I are similar to every other Prince Edward Islander. I think there's a certain frustration that comes when you hear something like this. I don't think any of us believe that anybody wants to knowingly pass on COVID to somebody else and risk them getting sick or worse. But I still think there's a certain nature within some people and within some of us to think that it couldn't be me or it wouldn't be me, and they act differently than following some of the protocols. I think it is extremely limited. I think we've seen almost across the board a high percentage of Islanders following the health protocols really to a T, and that's been important for us to get to where we are. But I think we all get a little frustrated and disappointed when we hear something like this happen. We have said from the beginning and continue to monitor if I thought raising the fine from $1,000 to $2,000 or $5,000 would change this, we would certainly do it. I don't know how we can, what further penalties are needed to get people's attention. I think it really comes down to it's public education and adhering to the advice that is out there, and just realizing that nobody out there is a superhero. We're all capable of passing this on unknowingly to anybody else, and that is why we've been asking everybody from the very beginning to almost act as if we potentially have it to avoid passing it on. But I think we're open to doing anything we can to get through this and to make sure people are paying attention.
Okay, thanks so much for that. And Dr. Morrison, maybe you can take this one on. Do we know if the daycare worker unknowingly went to other locations before she realized that she was positive for COVID-19 other than work?
So, hi, Louise. So that would have been part of the contact tracing, and so there are no other public exposure notifications associated with that case. I just thought I'd add, but when we're talking about testing and not knowingly spread, I think one of the cases that I talked about today related to the daycare tested negative initially, and then I think it's just a reminder, we've talked about it before, one negative test doesn't mean that you do not need to stay in isolation. And I think it's, we continue to have that emphasized, and so it's worth mentioning again.
Is there any idea of how many people are now in self-isolation as a result of this? I'm thinking of all the family members that might be now at home with their children. Is there an idea of the volume of people that are now self-isolating?
I mean, as you said, I think we certainly know that we have, close to 50 families impacted, families or individuals impacted. I don't have the exact number, but I know public health nursing is going to be, of course, in touch with all these individuals on a daily basis for the next 14 days. And it's something that we certainly we'll be putting together in terms of a total number in isolation, but I don't have the exact, but it would be certainly 50 families affected.
Thank you both very much.
You're welcome.
Gabrielle Drummond, Radio-Canada.
Good afternoon to you both. Ma question, c'est en français pour la docteure Morrison. Avant de poser mes questions, docteur Morrison, j'aimerais que vous nous dites brièvement les informations que vous avez données dans votre annonce en français, s'il vous plaît.
Bonjour Gabriel. On annonce deux nouveaux cas de COVID-19 aujourd'hui. Ils sont les individus dans leur vingtaine, à peu près 20 ans. Un des cas est un contact proche du cas hier. Et puis ils sont reliés tous les deux au voyage hors de la région atlantique. Et puis, on a fait contact avec les parents de 38 enfants. Et puis, il y a un autre 7 personnes qui travaillent au centre. Et en addition, il y avait 7 autres contacts à identifier. Et toutes ces personnes doivent isoler pendant 14 jours.
OK, parfait, merci. Alors, ma première question, c'est dans l'évaluation que vous faites par rapport à ce cas dans cette garderie, justement, maintenant on a 2 nouveaux cas. À votre avis, quels sont les risques par rapport à une grosse éclosion de la COVID-19 ici à Lille, par rapport à ce cas-là spécifiquement de cette garderie? Est-ce qu'il y a un grand risque d'une grosse éclosion?
À ce moment, je pense pas. On a identifié la source maintenant et puis on a mis toutes ces personnes pour isoler et les tests des enfants sont négatifs. J'espère tellement qu'ils vont pas devenir positifs. Et on va savoir vraiment dans les jours qui suivent. Mais il n'y a pas d'évidence de transmission dans la communauté hors de ces cas à ce moment.
Okay. Ma deuxième question, c'est juste un follow-up. Alors, compte tenu de ce qu'on voit présentement dans ces cas, et on a beaucoup parlé des gens qui ne suivent pas les règles de santé publique, alors quel est votre message que vous aimeriez envoyer et dire aux personnes qui ne suivent pas les mesures de santé publique à ce stade-ci de la pandémie?
On voit la lumière à la fin. On voit le premier ministre a dit le finish line. Et puis, alors c'est tellement important que tous les insulaires suivent les règlements. On veut, quand quelqu'un ne suit pas les règles, ça met à risque les autres. Et puis, ça peut avoir tellement d'impact sur les étudiants, sur nos emplois, partout dans nos vies. Alors, vous devez suivre les règles pour qu'on peut prendre soin les uns les autres. Et puis, on doit en faire un peu pour un peu plus de temps, peut-être 2-3 mois sont tellement importants. C'est pas seulement vous-même à risque, mais c'est les autres et la communauté ici à l'île du Prince-Édouard à risque et beaucoup d'impact.
Merci beaucoup. Bonne journée.
Bonne journée. I might just translate that. I think it's just worth mentioning. I mean, I think we all hope that we don't have any of the children who convert to positive or anybody else in the days ahead. And because I think that's the big concern right at the moment. It is reassuring to know that the source has been identified. But it's a reminder when these things happen how quickly it could impact and how quickly it could spread. And I think we all felt that yesterday. And so I think we're still concerned about the people who have been impacted and how much that affects their lives. But we're also hopeful that it doesn't spread any further in the community.
Marine Orneau, La Voix.
Yeah, good afternoon to you both. J'ai une question pour vous, Dr. Heather Morrison, en français. Je voulais savoir, comme ce sont des très jeunes enfants, comment ça se passe? Est-ce que même s'ils sont testés négatifs, ils doivent rester en isolement 14 jours?
Oui, c'est ça. Alors, ils vont isoler, ils sont tellement petits, ils vont isoler avec un parent, bien sûr, ou la famille, mais il doit, comme tout le monde, doit isoler pendant les 14 jours.
D'accord. Et un follow-up, est-ce que dans les centres de la petite enfance, il faudrait plus de contrôle, de surveillance pour que les enfants portent des masques et également les éducateurs, tout le monde porte des masques dans les centres de la petite enfance?
Bonjour. On a vraiment les directions pour les centres des petits-enfants et puis avec comme un guide pour les mesures pour infection control pendant COVID. Et puis, je sais qu'il y a vraiment les inspections faites au centre des petits-enfants. C'est difficile pour les très jeunes pour porter les masques, mais c'est important pour les personnes qui travaillent là-bas de porter les masques. Alors, je suis sûre que tous les centres vont regarder leur règlement, l'éducation à propos de ça quand quelque chose comme ça arrive. C'est aussi une chance de s'assurer que les centres, comme les écoles, comme les business, ont des listes qui sont prêts à nous donner tout de suite, qui sont sont clairs, qui sont corrects, parce que ça nous aide quand on fait quand on essaie de faire les appels. Alors, on ne doit pas attendre pour les listes comme ça. Alors, c'est un bon, vraiment un reminder pour tout le monde d'être prêt à nous donner ces listes si quelque chose comme ça arrive.
OK. Merci beaucoup. Bon après-midi.
Merci. The one point I'll translate there in French is that, or into English, is that when these things happen, it is a reminder for all early learning centers, all schools, all businesses, to make sure that they have the list of in this case, children and staff, ready, accurate, legible, and in a timely fashion, because when there is a delay in getting that to public health, then it means that we're delayed getting, being able to reach out to people. So it's a reminder for everyone to make sure that those lists are ready.
Julien Lecachère, Radio-Canada.
Good morning to you both. That question will be in French for you, Dr. Morrison. Dr. Morrison, cette semaine, le Premier ministre a parlé d'un plan de réouverture qui serait annoncé la semaine prochaine. Est-ce que ce cas dans une garderie va repousser la présentation de ce plan pour une réouverture de la province?
Bonjour. Non, je pense qu'on va parler d'un plan peut-être la fin de la semaine prochaine ou même on va en discuter et nous sommes en train de préparer un plan de réouverture vraiment de la province, mais et puis toutes les provinces sont en train de faire même sorte de choses partout au pays.
Docteur Morrison, une autre question, si je peux me permettre de sortir un petit peu du sujet de la garderie. Je voudrais parler du vaccin AstraZeneca. J'espère que vous allez pouvoir me répondre aujourd'hui. Certaines provinces ont décidé d'arrêter d'utiliser le vaccin AstraZeneca. D'autres provinces décident de ne plus utiliser pour la première dose. Quelle est la position de l'île du Prince-Édouard sur le AstraZeneca? Est-ce que vous souhaitez arrêter complètement l'utilisation du AstraZeneca?
OK, on va en parler mardi, vraiment, mais on a déjà vraiment remplacé les doses d'AstraZeneca avec Moderna chez les pharmacies. Alors, mais on va donner plus de détails en mardi.
Merci beaucoup.
OK, merci.
Well, thank you very much, Dr. Morrison. Enjoy your weekend, and to all Islanders, stay safe. Thank you very much.